I want to be a medical assistant because I want to be able to work closer with my Native community. Right now, in my current position, I have the ability to work somewhat close, but in a one-on-one setting, I'd be able to definitely help a lot more and be on a more personal level with them.
Because it's very satisfying working with people. It's definitely a people person job, I think, and you get such a wide variety of people in different situations. Sometimes it can be stressful because people are kind of anxious, or things have been postponed a long time and they're very worried about their health, or they're in a bad situation. But you bring that professional calm and allow that healing to take place. So it's very satisfying.
It makes me feel great. I feel like to be able to have an impact on at least one person or one family is huge, because that can trickle down to other families and other patients.
I enjoy helping people navigate through the healthcare system. Obviously, helping people in need get treatment is very important to me, and also kind of opening up services that are not available to specific communities. For instance, we live in a very rural area and there are no dental providers and there are no mental health providers. Those are two areas that are really, really missing. And so our clinic has been able to build a dental program and build a mental health program. And now we have 2 therapists, we have 2 dentists, we have 3 medical providers, and it's just growing and growing. Now we're opening a substance abuse program with therapists, or counselors.
So it's exciting.
It's exciting.
And exciting for you to be part of that?
Yes, because the need was always there, and so when you finally open those doors, the people just come pouring in. So it's a good feeling.
It makes me feel like to appreciate more of the people that I help, because the way I believe is the more education, the more knowledge that I have, the more that I can offer people to help them.
I feel like I listen closely to the physicians as well as the patients, so I always want to be able to hear them out and help them in the best way that I can.
Great question. Okay, so working in the medical field, you can change lives, impact families. Tell me how that makes you feel.
It makes me feel good just because, like me myself, with a new baby, I know how it feels to be vulnerable in the medical setting, so I just want to be there to be able to comfort patients and make them feel like they can open up and ask questions.
So I got trained on the job there, learned all the skills and a lot of patient education, and I learned to speak Spanish there, medical Spanish, and then moved to Santa Rosa, started a family, worked at a health clinic there, and then basically raised my family for about 7 years and didn't work. And then recently, it's been about 7 years now, we live in Fort Jones, which is Northern California, kind of a remote area. And my husband took a job at the Quartz Valley Indian Reservation, and then a couple of years later, I took a job there as a medical assistant. So I've been doing the job as a medical assistant without a certificate, which I've always wanted.
So we talked all night.